whenever you're looking into the right atrium here, you'll have one hole that's more cranial here, and this is the cranial part. This is caudal. Cranial hole here will be the caudal vena cava. The more caudal hole will go into the coronary sinus, which it would be right under here, and it's coming from the veins, the coronary veins that supply the heart, and all the blood that's deoxygenated that comes from the body empties into here. Then after it goes from here, it goes through the right atrioventricular valve. You can also call it the tricuspid valve. Tricuspid. And it has 3 cusps, so 1, 2, 3, and this one's kind of hanging off right here. After that, you have the chordae tendineae going to the papillary muscles, which are the muscles that hold them. And then you'll have on the other wall, more lateral part of it, you'll see the trabeculae carneae. You want to make sure you don't confuse those words. And then only in the right ventricle you'll have a moderator band, and it just moderates the pressure change because there's a pretty big pressure change when the blood comes through. And also, while we're looking at it, there's muscles that are attached to the auricle. So this was the auricle, the muscles here. These are the pectinate muscles. They're in both the right and the left atrium, and they pull on the auricles to kind of help with the pumping motion of the blood going through the heart. Then after the blood goes through, you hold it back in anatomical position. After the blood goes into the right ventricle, it's going to go up through this hole, through the pulmonary trunk, which is right here, into the pulmonary arteries and then to the lungs. And whenever you're trying to find the holes for the ventricles, they're always going to be on the ventral side. So the pulmonary trunk one will be here, and then for the aorta that comes off of the left ventricle, it'll also be more ventral, the hole for it. And after the blood goes through the lungs and it goes through the pulmonary veins, the pulmonary veins are here. You'll just see different holes on these sides. There's a bunch of them. There's about 4 of them, but you don't have to know where all of them are as long as you can see where particular ones are. And when you stick the probe through, you'll see that it goes into the left atrium. So this is where the deoxygenated or the oxygenated blood goes after it's gone through the lungs. And also, once again, inside of this left atrium, you have the pectinate muscles deep in there as well. And it goes through the bicuspid valve, or you can call it the left atrioventricular valve.
Or the mitral valve.
Or the mitral valve, whichever you prefer. It has many names. And again, it has the chordae tendineae, the papillary muscles, and then the trabeculae carneae, or the trabeculations. And it does not have a moderator band. And then, after the blood goes to the left ventricle, it goes up. As you saw with the cat, there's different branches of the aorta. The one I'm sticking it through is actually the main part of the aorta, and then the branch that's here, that is more towards the right side, is the brachiocephalic. So, if you remember for the cat, after you have the aortic arch, which would run around like this, the brachiocephalic would supply blood to the right side, and the left subclavian branch of the aorta would supply blood to the left side, the left arm in that region. And also, you want to make sure you know the interventricular septum. It's hard to visualize or see the interatrial septum, but it's just the septum between the 2 atrium. And other than that, make sure you know that all the arteries and veins that supply the heart are the coronary arteries. And also, whenever you're going through the aorta, there's a aortic semilunar valve up there, so I could say what is the valve that the blood goes through after it leaves the left ventricle and goes to the aorta, and that's the aortic valve. The one that is in the pulmonary trunk that goes to the lungs is the pulmonary valve, so their names correspond to the vessel they go to. And that's pretty much it.